Hi, welcome back. How are you today? Today we are diving into an essential topic in medical field, IV fluids. IV fluids play a vital role in patient management from hydration to medication administration. Whether you are a medical student, a healthcare professional, or just curious to know about the types of IV fluids, this video will give you a clear understanding of types, uses, and importance of IV fluids. So let's explore the topic together. IV fluids are liquid administered directly into the bloodstream through an IV line. They help treat dehydration, deliver medications, and support vital body functions. But did you know there are different types of IV fluids, each used for specific medical conditions? There are two main types of IV fluids, crystalloids and colloids, where crystalloids are the most commonly used IV fluid in medical practice. The term crystalloid comes from their composition. They contain small crystal-like dissolved molecules such as salt and sugars, which can freely diffuse across the cell membranes and capillary walls. Let's check the uses of crystalloid. First one, restore fluid balance. They help replace lost fluids in dehydration, blood loss, or surgery. Second one is maintain electrolyte balance. They contain essential electrolytes like sodium and chloride supporting normal cell function. Next is improve circulation. By increasing the blood volume, they help maintain blood pressure in conditions like hypovolemia or shock. Since they are small molecules, crystalloids can pass freely between blood vessels and the cells. They help in quick rehydration and distribution of essential nutrients. Compared to colloids, crystalloids are more affordable, widely available, and have a lower risk of allergic reactions. Next is about colloids. Colloids are used in medical situations where fluid retention in the blood vessel is crucial. Colloids contain larger molecules that stay in the bloodstream for a longer period, making them useful in specific conditions. Let's check uses of colloids. First one, hypovolemic shock and severe blood loss. Colloids such as albumin and hetastarch help restore blood volume in cases of massive hemorrhage, trauma, or surgery when rapid volume expansion is needed. In severe burn patients, fluid shift from the bloodstream to the tissues occurs due to capillary damage. Colloids like albumin help pull the fluid back into the circulation and thus reduces edema. In case of hypoalbuminemia, that is low blood protein levels in conditions like liver disease, nephrotic syndrome, or severe malnutrition, which causes the fluid leakage into the tissues due to low oncotic pressure. While giving albumin infusions which restore the oncotic pressure and preventing the fluid loss from the blood vessels. In critically ill patients with septic shock, colloids can help maintain BP and circulation when crystalloids alone are insufficient. Patients in ICU or post-surgical unit, they receive colloids to maintain stable BP and prevent excessive fluid buildup in tissues. Colloids remain in the circulation for a longer period, so they are preferred over crystalloids in patients at risk for fluid overload such as heart failure or kidney disease. So far we have covered types of IV fluids, crystalloids and colloids and its uses. Crystalloids are again divided into isotonic fluids, hypertonic fluids and hypertonic fluids depending upon tonicity, the amount of solute concentration in the given fluid compared to blood plasma and body cells. What is the significance of this tonicity? Depending upon the tonicity, that is iso, hypo or hyper, it can be used to treat different medical conditions. For better understanding, you should know the concept of osmosis. In osmosis, the solvent molecules moves from area of low solute concentration to the area of high solute concentration. Here the solvent molecule is moving. Here you can see two solution 1 and 2. This is sugar solution. This small red colored one is water molecule, that is the solvent molecule, and the orange colored one sugar molecule, that is the solute molecule. Solvent, here it is water plus solute, here it is sugar, for what? Solution. Here it is sugar solution. Okay, the solvent molecule, here the water molecule moves from the area of low solute concentration to the area of high solute concentration. Here you can see the sugar molecule concentration is lesser in solution 1 compared to solution 2. So the water molecule, this water molecule will move from the area of low sugar concentration to the area of high sugar concentration. This same principle is used in the treatment of certain medical conditions using IV fluids, iso, hyper and hypotonic. Let's see how the principle of osmosis works with IV fluid. First, about isotonic fluid. Isotonic fluid means they have the same concentration of solute as blood plasma as well as body cells. In this case, when we give isotonic fluids, there is no net movement of water in or out of the cell. Why? Because the solute concentration is same in both sides, in and out of the cell, the same solute concentration. In the blood vessel as well as in the body cell, same solute concentration, so no net movement of water. Examples are 0.9% normal saline and ringer lactate, which can be used in the fluid replacement in case of dehydration, blood loss or surgery. In all these cases, treatment intention is replacing the lost blood volume. There is no need of moving the water out of the cell or into the cell. So, in such cases, we can use isotonic fluid as treatment option. Next is about hypotonic fluids. Hypo means less. So, hypotonic fluid have a lower solute concentration than the blood plasma as well as the body cells. So, when we give the hypotonic fluids like 0.45% saline, 5% dextrose in water, what will happen? The solute concentration is lesser inside the blood vessel when give hypotonic fluid. So, net movement of water occurs into the cell, thus cellular dehydration will be corrected. It can also be used in case of DKA and in HHS, the hyperosmolar hyperglycemic state, where the sugar level is greater than 250 mg in DKA and 600 mg in HHS. In DKA and HHS, first using isotonic fluid, then only use hypotonic fluid as a treatment option. Why? In these two cases, both the cellular and intravascular dehydration is there. To correct the intravascular dehydration, we are giving the high isotonic fluid, and to correct the intracellular dehydration, we are giving the hypotonic fluid. Next is about hypertonic fluid. Hyper means more. So, hypertonic fluid have more solute concentration than blood plasma and body cells. When we give the hypertonic fluids like 3% saline, 5% dextrose in normal saline, 10% dextrose, etc., net movement of fluid from the body cells into the blood vessel occurs, because hypertonic fluid create more solute concentration inside the blood vessel compared to the body cell. So, as per osmosis, the solvent, the fluid will move from the lower solute concentration to the higher solute concentration. This type of fluid, hypertonic fluid, can be used in case of cerebral edema. In cerebral edema, our treatment intention is to reduce the fluid from the body cells. So, when we give the hypertonic fluid from the brain cell into the blood vessel, the fluid shift occur. Thus, the cerebral edema get corrected.